Hi, my name is Daniel Lundberg. I'm a student physical therapist assistant from Jeff State. Today I have a patient who is 45 years old, female, who's been diagnosed with carpal tunnel syndrome in her left hand. Carpal tunnel syndrome is a peripheral nerve injury, or peripheral nerve disorder rather, where the median nerve is compressed between the carpal bones and the transverse ligament that crosses the palm of the hand. The median nerve innervates the thumb, the index finger, and the middle finger. When it's compressed, it can cause pain and sensory loss. This patient had surgery 5 days ago to relieve compression on the median nerve. This was done by an incision to the transverse ligament, and she now has a 4-inch scar that runs on her hand right here. We will show you in just a second. She has 6 sutures in her hand, and they will be removed in 5 days. She has some pain and moderate edema around the incision. She also reports sleep disturbance once a night, and she has difficulty with fine motor skills. She is wearing a cock-up splint, which keeps the wrist in slight extension, and she has some bulky dressings due to the surgery. Here's our patient here, Mrs. Rutledge. How are you doing today, Mrs. Rutledge?
I'm doing great, thanks.
Great. Well, today what we're going to do is we're going to work on your hand and get you progressing after your surgery so that you can have maximal function in your hand. What we'll do to start out is we'll put ice over the incision site right here. I have taken off the dressing and the splint to perform the surgery, to perform the therapy, and when we're done we will put it all back on. Alright, so after it has been iced for 15 minutes, what we're going to do is soft tissue mobilization in the form of massage. And right now, normally I would focus on the scar as well, but since she has her stitches in still, we need to wait until they come out and until it has healed some. So what we're going to do is some longitudinal massage. I'm just going to warm up the tissues here of the wrist flexors. What this is going to do is help address any adhesions and restrictions that she has while the wrist has been immobilized in the splint. Does that feel okay, Mrs. Rutledge?
Feels great.
Okay. So what I'm going to do is a longitudinal massage, just going along the muscle fibers. Very slowly, looking for any restrictions. And when I find one, I will use sustained pressure to help address it. And normally this would take between 10 and 20 minutes, just depending. And I'm not going to focus so much on her hand today. Normally, I would massage the fibers in her hand too, but since she has the sutures in, I don't want to pull too much on them, but I will do the fingers. And just address any restrictions she may be having there. And like I said, once the sutures have been removed, we are going to do cross-friction massage on the scar tissue, which will help get the scar tissue to organize properly so that she does have maximal function of her hand. You doing okay, Mrs. Rutledge?
I'm doing great.
You have any questions or anything?
Nope.
Alright. So, let's say that's done. Okay. So now what I want to do is I want to go over some education with you. You know, what you need to do right after your surgery. I want you need to keep your wrist either in neutral, which would be straight, like this, in a straight line. No active flexion, which would be bringing your wrist forward.
Okay.
You can keep it backwards if you want. That's fine. You know, wear your splint as much as possible. And while you're doing these exercises, it is okay to move your fingers, but if the splint is off, no flexing your fingers and bending your wrist forward at the same time.
Okay.
Because what that'll do is, if you do that, the tendons could pop out through the ligament that was cut. So we don't want to re-injure and make the situation worse. So you want to keep it straight or in extension, and if you passively bring it forward, just no finger flexion like that.
Okay.
You understand that?
Okay, so if I have to bend my wrists forward, don't bend my fingers.
Correct.
Okay.
Yes. You have any other questions?
Mm-mm.
All right. Great. So now I'm going to teach you an exercise that's going to help maintain proper movement in your fingers. Okay. This one is called a tendon glide.
Okay.
And this is a very important exercise to perform after carpal tunnel release. It keeps the tendons moving smoothly, and it keeps them from getting stuck while they're healing. So you have proper function, after everything is all healed up. Okay?
Okay.
So this exercise, it's going to start with the hand straight, and then you're going to go to a hook position, and then back to straight, and you're going to do that 10 times, and then straight to the fist position, and back to straight, and you're going to do that 10 times, and then straight to the tabletop, and then back to straight, and you'll do that 10 times. So I'm going to go over this with you.
Okay.
This sheet of paper, we'll start with your hand straight like this. Okay. And we're going to bend your fingers forward. Make sure your wrist stays neutral or back. Okay. And then back straight again. And do that 10 times.
Okay.
Looks good. 4, 5, 6, 7, 8, 9, 10. Okay. And the next one, we're going to curl your fingers under like this.
Okay.
Yeah, just like that, keeping your wrist straight. Okay. And back to straight, and we'll do that 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And for the last one, we'll do the tabletop, where you bring it down like this, keeping your fingers straight. You just bend your knuckles, and then back to straight. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. Okay. Do you have any questions on that exercise?
Nope.
Okay, and like I said, it's very important you keep your wrist straight when you're doing it. If you do have any pain while you're doing it, don't bring it down as far. You can just come to where it is pain-free and go back up. And then slowly work your way down as the pain subsides. I want you to do these exercises 3 times a day. Okay. It is fine to do them more than that, but at least do them 3 times a day. It's very important to keep those tendons gliding freely. Okay. You have any other questions or anything on that? All right.
Thank you.
Great. And I'm going to give you this exercise program sheet to take home.
Awesome.
Alright, and I want to let you know that after the stitches are removed, we'll progress to a more active approach, doing more dynamic exercises. But this is pretty much what we need to do right now while you still have your stitches in. Okay. Alright, you should be able to return to full activity within 12 weeks. I do want you to know it is normal to have decreased strength and in your grip and in your pinch, because there's been a change in the length-tension relationship of the muscles in your palm here, and so that is perfectly normal for you to have that decreased strength, and it should resolve itself within 3 to 6 months.
Okay.
Do you have any questions or anything?
No.
All right, great. I'm going to send you this home, and we'll put your splint back on and your dressings. Okay. And you're good to go. Thank you so much.
Thank you.